For providers in rural communities, there's extreme pressure and stress on them to be able to do everything and to know everything and to see everyone. I am not everything that every patient needs. Having a clinical pharmacist's expertise is absolutely critical to provide the best possible care for our patients. If we're able to establish a CPA in that setting, it's not only going to benefit our patient population and enhance our quality of care and our patient satisfaction, it's going to support the providers in a way that most likely will lead to less burnout and more sustainability of their practices.
The collaborative practice agreement, that's really just kind of a fancy term for a contract or an agreement with another type of healthcare provider. The whole concept is to build team-based care. We no longer exist in silos. There's just no way to accomplish patient care needs these days without implementing some degree of team-based care. So these collaborative practice agreements really enable team-based care. Patients give us feedback that they kind of feel like a superstar because they were able to have two providers with them during their visit. That opens communication and there's less opportunity for patients' care to fall through the cracks.
My workflow is much more efficient by being able to work with Dr. Woods. So there's hands down an absolute time-saving component to having a CPA. Without her support, would significantly slow me down, and I maybe wouldn't be able to see as many patients.
No one has the skill set of a pharmacist but a pharmacist, and oftentimes they're overshadowed or underappreciated because they are seen as just sort of that pill counter that dispenses a pill, and that's so very little of what they really are doing. They're really the gatekeeper for medication safety and detecting errors and doing so much of the in-between, behind the scenes, go-between work, and so their role is critical.
We're constantly learning from each other. She's an amazing resource and always willing to continue my education.
I bounce as much off of the providers that I work with just as much as they bounce things off of me. Because, everyone has a different nuance to how they can accomplish something, and maybe depending on their skill set, they can be more efficient in that. But everything's a business, and ultimately we are trying to decrease costs. And so we need these teams to work together to better care for our high complex patients to overall decrease costs. That's the concept of value-based care.
And I think the bottom line is there's going to be more benefits than cash flow. Your patient satisfaction is going to improve, your quality metrics are going to improve, providers' ability to produce more and see more patients is going to increase. Maybe my ability to recruit providers is going to increase. And so rural Wyoming and hospital administrators and healthcare administrators shouldn't limit themselves by saying we're too rural, we're too small, we can't afford that, because you absolutely can, and the benefits far outweigh the cost. I'm very blessed to have the relationship that I do with Dr. Woods. If you have the opportunity to partner with a clinical pharmacist to help support your patients, you should do it. You should take that opportunity and run with it. The potential benefits of that collaboration are something that you don't want to miss out on.